Good evening, everyone. This is Dr. Vrishali from Medflix, welcoming you for this amazing session on listening nudges by Dr. Krishna Naineni. I'll just give a short introduction to what exactly Dr. Krishna does and how important listening is in clinical management. Dr. Krishna is the director and co-founder of Global Academy. Is also the member of International Listening Association and an echo listening practitioner. He's a general practitioner in southeast region of England. He is a training faculty at the Brighton and the Sussex Medical School. He's passionate about listening education, research and practice. His goal is to raise awareness about the significance of clinical communication in clinical practice. So I would like to welcome you, sir, on behalf of Medflix. Sir, I would like to hand it over to you now.
Okay.
Yeah.
Thank you, Rushali, for that wonderful introduction. Couple of additions to that introduction. If you have seen 1983 movie, we live in the same town as the movie is shot, Tunbridge Wells, and I work in a place where my patients are Winnie the Pooh, Eeyore, and Tigger. So that's Ashdown Forest. So you may want to look it up. I'm a chair for International Listening Association's healthcare team. If any one of you are interested in knowing more, please reach out. We want to get started with a one question poll. We are offering a small group. I would like to emphasize the point: a small group, up to 12 participants per group, paid sessions, a series of paid sessions to help you in enhancing your clinical communication. Anyway, let's get on with with the topic in hand: listening nudges. As you might have read in the description, the purpose of the session is how can we help you in enhancing your clinical communication? How can we optimize your interactions with patients in time limited consultations? We are acutely aware how less time we are having with patients. How can we do more in the limited time we have without compromising on the quality of the interaction? That's the important point. Without compromising the quality of the interaction, we believe that with certain nudges that we want to call, we can do it, we can achieve it. And we would like to engage in a dialogue, in a discussion with you throughout the session. We would like to hear your views throughout the session. So participate more. The more you participate, the more you're going to take home with you. And we would like to continue our discussions in these sessions going forward. So we would like to welcome you all, and we want to thank you for your presence. That's great. You being here have shown that you would like to enhance your clinical communication. That's a beautiful thing. And I would like to express my gratitude to these great thinkers, listening scholars, researchers, and authors. Their work has influenced and is influencing my listening and clinical practice. The references for this session are available on request. Do ask me if you are interested in any paper or any concept that I mentioned. I'm very happy to share all the details with you. So that's the purpose, as I mentioned. How can we achieve more in the limited time? How can I help you in consciously integrating these nudges into your clinical conversations? What I would like to start with, make clear the meaning of certain words which I'll be using again and again throughout the session. So whenever you hear me using these words, you are very clear what meaning I'm giving to them. So have a look at this slide. And if you want to take a picture, take a picture. So nudge is anything that we do to encourage, in our case, the patient to share their narrative, to share their concerns. Our body language, or our listening response. It can be anything. Listening, the definition, listening, the definition which we give is by mentor Michael Purdy. It's an active and dynamic process of attending, perceiving, interpreting, remembering, and responding to the expressed, both verbal and non-verbal needs, concerns, and information offered by another human being. Swati, we would uh, give you the references. Perception, it's all about the meaning we create out of the sensory experiences. What meaning do I give to what I'm observing, what I'm seeing, what I'm hearing? Conscious, the meaning which I'm going to, with which I'm going to use this word is an effort, a conscious effort. It's about having awareness of surroundings and sensations and thoughts, in our case, responses. So these are the words which I'll be using again and again, and that's the meaning of these words are on the screen. I would like to ask you to take a stroll down in your memory lane. Take a stroll down in your memory lane and recall a conversation that you had with anyone where you felt listened to, or you might have felt, oh, that person actually listened to me. Um, where you felt happy, satisfied, where you felt like you could share your real concerns. Take a stroll down in your memory lane. What did that person do to make you feel listened to? What did that person do? Is it something they've said, or is it their body language? Can you share your responses in the chat? Rishali, can you time a couple of minutes, please?
Yes, sir.
I would like to hear, what did that person do? If anybody wants to come on the screen, they can raise their hand and come on the screen. What did that person do to make you feel listened to?
Sir,
Kumar,
yeah,
Ajay
I'll
Kumar.
accept the request, sir.
Meanwhile, the others, could you please share the responses in the chat? Let me know.
Hello, sir.
Hello, Ajay. Hello again.
Sir. Yes, sir. Experience last year previous session. I feel that I was listened by you because you took interest in my interest. That
Mhm.
was, I think, you remember that magician. So
Yes.
yeah. So person who take interest in our interest, his body languages and all that shows that we are being listened by someone and he care for us. He is interested in what we are interested. That's all.
Okay. Wonderful. Ajay, haven't paid Ajay for this response. He voluntarily came onto the stage. Can you read out eye contact, body language, and a comfy smile from Janvi Rishu? Hello, Janvi. Good to hear from you after a long while. Any other comments,
Yes,
Vishali?
sir. Yes, sir. There's one that interest and understanding.
Okay.
Dr. Arya says listened without any intrusion in between.
Uh-huh.
Dr. Mahesh says eye contact.
Uh-huh.
Dr. Swain says body language and verbal communication.
Mm.
Yeah.
Arushi. Okay. Arushi says
The listener
smile.
calmly listened to all my worries, plus expressed an explicit positive body language.
Okay. I'm sure that many are thinking in the similar lines. This is something that you might have felt, like Ajay mentioned earlier, that they given great interest in whatever you say through their body language or through their presence, and they might have made you feel secure, maintain a good eye contact, and might have not lost their cool, demonstrated tolerance throughout. So these are some of the things which people feel when they are listened to. This is a scale which is called layperson-based listening scale, which you could do with your colleagues and patients to test how well you listen. However, today's session is all about how can we put these things into practice. What are the things that we can do to make sure that the patients feel listened to? Have a look at this picture. What's happening here? Is the doctor, is the clinician listening to the patient? Imagine that the patient has, you welcome the patient has, patient sat in the chair and you got a call. That's the context. What does the patient perceive? Swati quite rightly says the doctor is not listening. The patient perceives that you're not interested or she's not the priority. She's not being listened to. How can she tell? What is the doctor doing? Very important for you to participate because everything matters. Everything matters. Our actions, our everything matters. So, what is the doctor doing? Can anybody give a running commentary of the doctor's actions? What is he doing?
So we do have a reply. Dr. Arushi says the
Okay.
patient felt not worthy of the doctor's time at the moment.
Uh-huh.
Dr. Mahesh is saying feeling of neglect. Doctor is busy on cell phone.
Okay.
Uh,
He's laughing.
yes, Dr.
He's
Ajay
laughing as
Kumar is
well.
saying patient might feel neglected.
Yeah.
Dr. Yunis Khan says doctor engaged in his own task. Patient
Mm-hmm.
astonished.
Mm-hmm. So the doctor is facing the patient. However, he took the call, and it's amazing what his hand is doing. He's saying that, wait, I've got something else to
Yeah.
do, more important thing to do. Maybe he's talking about 1983 movie, The Review, or Pushpa, or who knows? I don't know. Don't know what he's doing, but at that moment, the patient felt that the doctor is not listening or not interested in this consultation. He's not here. I know I've taken an extreme example of interruption and answering the mobile. I'm mindful that many of you do not do that. However, the interruptions can happen in many forms and shapes. When is the last time you have reflected on your consultation and thought for yourself that, oh, I do interrupt a lot? Have anybody reflected on your consultations? Or have anybody came across the person or a clinician or a doctor that interrupts you a lot, or observed a clinician who interrupts the patient a lot? What do they do? Do they do they take over the patient's narrative in the middle? Do they respond too quickly after the person has finished talking, or engaged in a different task like this clinician is doing when the patient is sharing their narrative? As I said, the interruptions can come in many forms and shapes. Interruptions are common source and common cause of patients feeling not listening to. Patients perceive that they're not being listened to, and that breaks the communication. When patients feel that they're not listened to, that they do not share their real narrative. I'm using the word real in the sense that they are judging you. They are perceiving whether is it worth sharing my story with this person. Easy caring. Is there trust here? Only when those conditions are met, the patients start narrating their real story. What shall the clinician do when he starts the consultation? How many of you put your mobile phone away when consulting with patients? How many of you put your mobile phone in silent when consulting with patients or taking history from patient? Ask yourself. The more you ask these questions, the better. Yes, it may be an emergency call, but he's laughing. His facial expressions do not reflect that. If he is taking an emergency call, maybe it's worthwhile highlighting to the patient that actually this is an emergency call. I need to take this. There is no role for that hand to say wait. We could do that differently. Can you see? These are little nudges that needs to be mindful of. we need to be conscious of our actions throughout the consultation. Rishila, can you put that poll now? The
Yeah.
second poll.
Yes, sir.
Balvinder Singh, we'll answer your question in the question and answer towards the end. Okay. What do you think of this poll? Listening is a cognitive function that is perceived behaviorally. Answer this question based on what we have discussed so far. Is a cognitive function that is perceived behaviorally. Absolutely. Absolutely. It is true. You have seen it and you'll see it again. Here, the patient is narrating their story and the clinician is looking at the computer. The patient is perceiving that the clinician is not listening because he's not maintaining good eye contact. However, I wonder what the clinician is perceiving his actions as. I wonder why he is looking at the computer. Does he feel that he doesn't have to look at the patient because he's hearing everything that person is saying and he's got limited time and he need to really put everything in the notes because he won't have enough time? His clinic is busy. What might be the reasons why the clinician is looking at the computer? Anybody? Any thoughts? What do you do when you are taking history from patient? Do you write in the notes? Do you look at the computer?
So Dr. Arushi, Dr. Rani are saying maybe he's showing something related to patient's issue or he's going through patient's charts.
Yeah,
Dr.
patient
Pranshu
shows.
says, yeah, Dr.
Okay.
Pranshu says he's multitasking. Dr. Balvinder says he
Multitasking.
might be checking reports.
Oh yeah. All those things are true. Multitasking. Can we actually do multitask? If we are multitasking, are we not breaking and dividing attention? If there is a division in the attention, is it not that we are not listening to entire story? If he is really looking at the reports, has he warned the patient, the patient? Did he signpost? Did he talk to the patient that I might have to look at the computer? If he has done that, fair enough. The person will wait until you finish checking the report. So, what warnings did the person give? Is also important. If you were to check the notes, reports, and look at the computer, it's worthwhile highlighting that to the patient. Oh, thank you for sharing that story. I need to check or confirm a couple of things in the report or the notes. I'll do that and I'll come back to you. That helps. Mm, Actually, vocalizing your thoughts with the patient helps to walk along. Otherwise, they feel that you're doing your own thing. You're more interested in finishing off your task, in completing your agenda, in moving to the next patient. They feel like they are rushed. And patients may not always mobilize their concerns through words. They may also want you to look at them because they are telling something through their body language. They want you to pick on those subtle clues which they are showing. If you're looking away, you miss the opportunity. It's very important. Yes, patients feel ignored. The moment it happens, they do not share their story. Remember, almost all of you said it's a cognitive function, but perceived behaviorally. What patients perceive matters. What patients perceive matters. By looking at doctor's actions, they are perceiving that he is not listening. This is why it is important. I'm not sure if you all can appreciate it. In this case, the patient, is the patient perceiving the doctor is listening or not? In this case, no. For example, assume that The doctor is looking at the patient, like here, is maintaining good eye contact. He's looking at the patient. The patient has got a smile on her face. She perceives that the doctor is listening. Look what happens. Look what happens. When they perceive that you're listening, they feel psychologically safe. They feel comfort. They feel that they are in a secure place. They trust in your actions. They want to share their narrative. Hence, they disclose authentic information, what I've called earlier the real narrative. For them to disclose their story, for them to share their real narrative, they have to perceive that you are listening. That condition has to be met. This is called episodic listening theory by Avram Kluger and colleagues. Wonderful theory. This is why our actions matter. This is why what we do in that early part of the consultations matter. They must perceive that they're being listened to. How many of you feel that this doctor is listening to the patient? How many of you feel that the doctor is listening to the patient? Let me put it this way. Is there anybody who feels that he is not listening to the patient? If I say he might be facing the patient, there might be eye contact, he might be having an open posture and showing interest in the patient, but I might be a devil's advocate here and say that's not enough. Maintaining eye contact is not enough. We should do more than that. All of you close your eyes. All of you close your eyes for a moment. Please close your eyes. What colors does Netflix logo has? And which letters are in different colors? So close your eyes and answer the question or think of the answer. And then look at the Netflix logo again. Rushali, can you show the Netflix logo?
Yes.
You might have seen this logo many times. How many of you got this right? So we might look at something, but that's not enough. The new research, there's a lot and lot of research in neuroscience accumulating is eye contact isn't enough. What is important is what are you attending to? What are you attending to? You may be looking at the patient, but if you're attending to something, then you're not listening. In this case, this clinician might be looking at the patient, but if he's attending to what's happening in his mind, or if he's thinking of the next question, or if he's thinking of the WhatsApp conversation that he was part of before calling this patient in, he's not listening to the patient. He might be looking at the patient, but he's not attending. So attending to the patient's narrative is very important. You may also ask, how many of you are here and attending to what I say? Or are you attending to something else that is happening in your room, in your mobile, or something that you are doing later tonight? Very important. If there is one thing that you want to take away from today, that's this point. What are you attending to? They say maintain eye contact. I want to go further and say, what are the eyes making contact with? Are your eyes making contact with the patient's narrative and the body language and the tone and facial expressions? Or are your eyes making contact with the knowledge in your mind, the patterns in your mind, the questions you want to ask in your mind? What are they making contact with? The moment you ask those questions, you realize where you are. Are you in the consulting room or are you elsewhere? They help you to be in the moment with the patient. Remember, you have to walk along with the patient. You can't run or you can't leave the patient in front and you walk slowly behind, or you can't, or take a diversion. You must walk along with the patient at the pace that is comfortable for both of you. That's the key point. That's what we wanted to demonstrate. Imagine this consultation. You're with the patient, nobody else is in the room. How many dialogues are happening? How many dialogues are happening in that room? And what are they? And between whom? Any guesses? Go on.
For
How
all
many?
the audience, you can type your answers in the comment
Okay.
section.
Asta says 2. Asta, what are those 2 dialogues? You want to come onto the stage? Raise your hand. Rushali will let you in. Ashish says 3. Swati says 3. I'm curious to know what are those 3 as well. Rushali, can you let Swati and Asti and somebody else say,
Yeah.
how many can you let in at a time?
We can have 3.
Okay,
people.
let those 3.
Yeah.
Go ahead. So what did you answer? How many dialogues are happening?
So I guess it's 2.
Okay. Where are those dialogues happening?
The first one, when the patient enters the clinic, first of all, he will come and tell his complaint, what the complaint
Yeah.
might be. For
Yes.
example, he complains of pain in headache.
Yeah.
He may complains of headache, or he may complains of fever.
Okay.
Then the doctor will ask some of the history, like uh, any kind of stress, or if he comes with the complaint of headache, first of all he will ask any kind of stress, or means any kind of stress does he is dealing with.
Well done. Thank you for sharing it. I would like to hear if there are any different perspectives or any different answers to what she is sharing. Thank you. What's your name again?
Sir, myself, Dr. Astha.
Hi, Asta. Well done for coming onto the
Thank
stage. Brilliant. Any takers, because this is very important that you all understand it. I'm going
Sir,
to
as
share it with you.
I am a dentist, so first of all, whenever patient comes in, he or she comes with the pain in tooth, any kind of pain. He comes with the gums pain, or he comes with toothache. So first thing he comes and say, my this tooth is paining, what is the reason? First thing he asks.
Okay. No, Asta, you made a good point. But everything which you shared constitutes one dialogue, which is the dialogue between the patient and the doctor, the history taking. That's only one dialogue, but there are more dialogues happening. What are they? Anybody? Those who said 3 are right. I would like to know why you said 3 and what they are.
Yes, I'll accept one more request we have.
Okay.
It's again Dr. Ajay Kumar.
Okay.
Okay, I think he again took back the request. It's not there. Well,
Ajay,
yes,
go ahead.
Okay. Yes, sir. Dialogue is also between the mind of patient and doctor, and mind of doctor and patient. Patient think that if I will answer this or I will ask this question, doctor will reply in that way, and doctor also thinks that if I will ask such question, patient will be answering in this manner. So
Okay.
at
No,
mind level also there is one dialogue.
you're close. You're close. Asta,
Yes,
as
sir.
Ajay is narrating his answer, there was a conversation inside you, is it not? Between you
Yes.
and inside you?
inside you. Yes,
Yeah, what was
that
that? What was
that
that?
was
Intra
means we want to know what the patient is thinking inside them.
Yeah,
We want to know
Yes.
what the patient is thinking inside him, what he wants to tell, and what we want to listen about, what the
yeah.
complaint he is coming with.
Very good. Right now, when Ajay is telling his answer, what was happening inside you? You had a conversation with you. What was it?
It was ki, what should we want to listen from the patient. The
Okay,
thing is that
very good.
what does we want to listen with patient, or what he is, what he wants to tell, his clarity, and we want to know, is are we clear with the patient, or is he clear with us.
Exactly. So let me clarify it. Thank you both for coming on. And listeners, there was a dialogue happening with you when me, Asta, and Ajay are having a conversation, which might have gone this way, which is, come on, Dr. Krishna, move on. We are running out of time. Or how long is this going on? That dialogue. You might be asking what dialogue? The person who is asking, the inner self. So when patient is narrating the story, there is also a dialogue happening inside you, which is, oh my God, why is this person not answering my questions? Why is that person taking so long? Oh my God, why is she crying now? So that's something. That dialogue is very important. And similarly, there is a dialogue that is happening within the patient. Oh my God, he is actually listening to me. Oh, I can trust this person. Oh, I really want to share my answers. We don't have any control on that inner dialogue. However, we can influence that dialogue by being in the moment, by maintaining good eye contact, by having open body language, by attending to the patient's narrative, and by showing curiosity in what they're saying. If you're curious on what they're saying, they will feel that way. And don't acknowledge the inner dialogue that is happening in you, but don't entertain that dialogue. Suspend that dialogue briefly and say, okay, I'm not going to really act on the dialogue. I'm not worried about what question to ask next. Let me listen to what the person is saying. If you do that, they perceive that you're present with your mind, body, and gut, whole presence. And guess what? Believe me, trust me on this. Magic happens because the questions will come out of the patient's narrative. Your facilitating responses will come out of the patient's narrative. You don't need to worry about. That is why the saying goes, listen to the patient carefully, they're telling you the diagnosis. This is what is behind that quote. You need to learn to suspend the dialogue that is happening inside you. To suspend it, first you need to acknowledge that that is happening. Do it from today. It's happening now, whether you like it or not. So these are some of the nudges that you can consciously integrate into your conversation. If you are the person who says, I know, I used to say, I know a lot, try and say, I'm listening, I'm learning. Try and say, try and say that. Once you say, I know, patients might feel that, how do you know? I haven't shared my full story yet. They might misinterpret what you're saying because they're paying attention to everything you're doing and saying. I know may carry a different meaning for you, but for them, I know is, how do you know? Rather than saying, I agree, try and use these facilitative responses. Go on. That's interesting. Can you add more? If you disagree with somebody, don't jump to prove your point. Pause, have a silent moment, and ask, I wonder question. I wonder why I'm feeling these feelings. I wonder why they may have this different view. So asking those I wonder questions and having that silence helps you to process your negative feelings and emotions well. Instead of saying, if you are the person who says, I understand quite a lot, try and swap it to one of these. responses. Oh, I'm curious to learn more about what you're saying, or summarize, or paraphrase. Okay, what does listening mean to you? What do you mean by listening? What do you mean by constipation? If the patients are using medical jargon, don't accept, because this might happen. If patients use medical jargon, you might take a meaning that you know of that word, but patients might be using it in a different context. Ask, oh, I wonder, what does chest infection mean to you? What does pneumonia mean to you? What does depression mean to you? What does caries mean to you? Gingivitis mean to you? Check the clarification, because these days people are talking to many of their friends, professionals, they're Googling, they're asking Siri, they are becoming more knowledgeable of medical terms. What you should do is, should is a very dangerous word, which means that you are advising patients without seeking more information, without getting more information. You might be prematurely advising the patient, or they might not be looking for an advice. Clarify the purpose of listening. When you're talking to the patient in clinical setting, yes, most of the time they want you to diagnose and treat. Sometimes their purpose may be different. Sometimes they may just want you to listen before offering advice. They will ask you what advice they want. Help me understand. Summarize. I wonder, what's your question for me? Ask. It helps. Try. Remember earlier I used the word conscious? This is what you have to do. Be willing to practice these things. Consciously integrate into your clinical conversations. Before that, my request for you is, if you are a student or an intern, buddy up with your colleague. Critically reflect each other's conversations with patients. Find out how, when you interrupt with patient. Find out how you respond. What are your default responses? Do you say I agree, disagree, or do you give advice too fast? What do you do? Because once you are aware of your default responses, and once you are aware of the ways you converse, of the ways you interrupt, and don't jump to integrate these strategies. Ask, why do I do the things the way I do? I don't want to interrupt the patient, but why am I interrupting the patient? Where is it coming from? Why do you interrupt? Ask yourself, why do I interrupt? Is it the fear of running late? Is it the fear of not able to consult all the patients? What is it? Why do you interrupt? Or do you feel like you need to take over the consultation? I don't know why you interrupt. We need to ask ourselves why we interrupt. There lies the answer. I hope you're appreciating what I'm trying to say. For example, you're driving along a country lane. You overtake the cars. That's your default. You overtake the cars if the car in front of you is going slowly than you. And there are two. I come along and say, oh, you should stop overtaking. Overtaking is bad for you. It's risky. It's dangerous. Would you like that advice? Or if somebody comes along and says to you, oh, Rushali, I saw that you do like overtaking. I wonder why you overtake so much. Do you realize that you overtake? Made them reflect on their actions. It's only then, oh, really? I don't think I do much. No, you've done 4 times in the last hour. I wonder whether you appreciate or understand the risks of it. Oh, really? Oh, maybe I'm doing it without my, doing it subconsciously because I want to reach early, or I don't want you to run late to the session. I don't know. When you have such a dialogue, they automatically change because they're all here to serve the patient. We are not here to show authority. We are here to serve. But sometimes, whether it is lack of training or busyness or increased workload, there are some of our actions which are not effective. When we ask and reflect on our actions, we change. We change. And these are some of the body language listening responses. Smile when appropriate. Not only eye contact, but ask this question: what am I attending to? What am I attending to? The pleasantness should reflect in your face and voice, because they're here to share their suffering. They're not there to share their happiness. They won't come to you when they win their lottery or when they buy a new car. They come to you when they have an accident or when they are feeling low, when somebody robbed them of their money which they won the lottery. They come to us when they are not well, when they are suffering. Be mindful and open body language. Everything is important. Every action matters. For a cricketer, every ball matters, For an actor, every dialogue matters. For us, every conversation should matter. Only then we can bring in some realistic and long-standing sustainable changes. These are your takeaway questions. Put this key in your radar all the time and keep asking these questions as many times as you can in a day. What am I attending to right now? What are you attending to? What do you say? How much jargon are you using? How are you saying it? And how you be? What's your body language? And when you say immediately after the patient completes their sentence, before takeover, or are you letting the narrative sink in? Are you digesting the material? Are you reflecting? Are you summarizing? How? Ask these 5 questions. I guarantee you that you'll be transformed. I guarantee you. Okay, here is a question. If I ask you, is listening important for providing quality patient care? Is listening important for providing quality patient care? How many of you are going, what is your answer? Yes, no? What do you say? What's happening in your mind now? Most of you would have thought yes, would have said yes and jumped to the answer yes, because quite rightly, that's the answer that comes to our mind. That's our conditioning. When we hear something that we recognize or believe in or value in, we quickly say yes or no, or don't know, or I don't believe. However, we seldom pause. Oh, yes is coming to my mind. Based on what? Based on my experience? Based on what I heard, what I read? I wonder why it asked that. If a patient comes with cough, fever, and phlegm, or if a patient comes with toothache, bleeding, and swelling, of course, the diagnosis of dental infection or tooth infection, chest infection comes to mind. But we don't ask what else it could be, because we recognize the pattern, and when we recognize the pattern, whether in control or without control, we rush to the diagnosis and management. But we don't usually pause and say, what else it could be? I wonder what the patient thinks about it. Can I get more information? So those little things help. I request you to look at this poem and let me know what your thoughts are. Agree? Can we look at new ways of consulting with patients? Can we? Do we have the capacity? Of course we have. Yeah. Yes, we can. If I can do it, you can do it. If your role model can do it, you can do it. We can do it. We need to have more of this dialogue. Sometimes these dialogues can be painful, like somebody mentioned in the comment, deep. We need to ask, are they deep? They are happening. Because the more we have, the more we engage in a dialogue and participation, the more we consciously reflect and ask questions like, why do we do these things? Why do I consult the way I do? Are there any better ways of doing? It becomes easier. If you have any questions, please reach out to email me. I'll respond to it. That's our Instagram page. Some of you are following it. Please do follow. We make more announcements on that page, and we also share few pointers on our Instagram page. And we also have free Thinkific learning modules, which you can, of course, take them. They are free. And Rushila, I think I've shared that link with Richa. If you have, you can post it in the chat.
Yes, sir.
And maybe do that poll again.
Yeah.
If anybody is interested in. Let me put it this way. We'll continue to do these free sessions every month. We want to continue to have this dialogue with you. However, we also realized from the conversations we had with certain people that they want to learn more, and hence these small group sessions, they are very cheap, I would say, compared to what you spend on movies and dining out. We are not taking many students in each session. 8 to 12 is the max. 8 is the minimum, 12 is the maximum. Why? Because we want to have more one-on-one conversations with you, help you really transform your clinical communication. We have 10 minutes for questions. Anybody want to come onto the stage and have a dialogue with me or ask me anything? Please do. For 10 minutes, I need to sign off at 3. Otherwise, my daughter won't be happy. I need to pick her up from school.
Yes, sir. Questions still might be dropping in. There are some good comments. Dr. Pranchu says, amazing session. You opened my eyes to the new perspective.
Thank you. That's what we want to hear. It's a new way.
Yes. Dr. Rani says, superb explanation. Thanks a lot. Then, yes, Dr. Astha also liked it. Thank you for this session. Dr. Sandeep says, thanks. I think everyone has listened properly. No questions. We don't have any questions as of now. That's about it.
Arushi, do you want to share your experience of listening with the audience? I know you've been practicing a lot. What's your message?
There's one question by Dr. Khan.
Yeah.
How to deal with the irritating patient?
Oh, yeah. We've got to be careful when labeling patients as irritating. You need to ask, what are the actions that are making him or her or them irritating? That's precisely what we'll be covering in more detail in those closed sessions, Mr. Khan.
Yes. So if you could talk about these sessions more bit, the modules which we were talking about, yeah.
The closed sessions or small group sessions, they will be very interactive. There will be pre-course material for you to really understand the concepts. And in the sessions, we'll have not only interactive sessions through polls and questions, but through activities. They can be role play or group activities, carefully designed to help you understand the concepts better. And after each session, you'll take away with practical strategies that you can implement in any culture in India. We are mindful of the adaptations that we need to make for Indian culture. So the sessions are how effectively we can give information to patients. Giving information, it's called listenability. We got several strategies. We're going to let you practice. The next session is on how to assess the risk the patients are taking and how to communicate that risk with the patient and help them change their lifestyles, like stop smoking or alcohol or take up habits or maintain a healthy emotional lifestyle. How can we assess the risk and communicate that risk back to the patient? These are the very topics that are being assessed in PLAB and USMLE as well. And the last session is on emotional competence. How to recognize your emotions and how to manage their emotions. Most students who have taken those sessions, which we have been delivering over the last 2 years, have said, forget about patients, Dr. Krishna. My relationship with my girlfriend, boyfriend, and parents have been transformed. So they are better able to manage their emotions in their actual relationships. Wonderful, isn't it? Those are pleasant adverse effects that we didn't expect to happen.
Win-win situation.
And win-win situation. And likewise, like Dr. Khan has asked, Janvi Rishu says, totally agree. Khan says, we also got a special session on, we don't want to call difficult or irritating or angry patients. We want to call how to effectively manage challenging conversations. Like, for example, Dr. Khan, rather than managing the irritating patient, we'll be asking about what made that person irritable. Was it something you did, or is it a system fault, government fault? What is it? Of course, there are certain things that are beyond our control, but how can you help patient to share the things that have made or making them irritable, and what can you do? For that, you need emotional competence, Dr. Khan. You need, because we need to be calm and composed. And you might disagree with some of the things which they say. How can you effectively listen to them through the disagreement? We'll teach you those things as well. So the important point is they are small group, maximum of 12 participants, because we know how important it is to have an interaction to help you become good communicators.
Dr. Arushi says she's having an amazing journey with Global Academy, and the deep insights has really improved her way of perceiving the patient's perspective. I'd say that's a step forward in becoming a better clinician. She says she'll try her best to incorporate all these teachings in a day-to-day practice. So it was great having you here. Thank you so much for this session, and we'll keep seeing you as we go ahead with the next modules as well. Thank you so much, and thank you to the audience as well for being here and being such good listeners.
Wonderful. Maya, thank you. Thanks a lot. Thank you everyone for coming and listening. Actually, I respect that. I'm very grateful. Okay. So you got our Instagram page and email address. Please stay in touch. The more we engage, the more we are in touch, the better it is. Okay.
Yes. Thank you so much. Thank
All
you,
the
sir.
best.
Thank you all.